Oh, there you go. You're fine. Well, it's great to be back. It really is. So grab a stool.
Yeah.
How's that sound?
That's good.
If you don't like the conference room here,
You gotta play. I love the
You gotta
conference
play
room.
Pence.
This is great.
I love it.
I like it. This is fantastic.
This is
Well,
manufacturing.
first off, thank you all. Thanks for joining us today. Thanks for taking time out of your busy lives. I want to thank Mike Gordon and everyone attended.
It's my pleasure.
Manufacturing for hosting us today. Looking forward to visiting with folks and making more formal remarks in a bit. But what President and I have tried to do as we travel around the country is listen as much as we talk. And we are very close to achieving a signature goal of this administration, which is to repeal and replace Obamacare and give the American people not only relief from those disastrous policies, but give the American people and American businesses the kind of health care reform that will lower the cost of health insurance, even while we give states all new flexibility to provide for the most vulnerable in our communities. So I'd really be I'd be anxious if you'd be willing to share, and we'll invite the media to stick around. Share your experiences with Obamacare. How important would it be for us to have the Congress pass legislation to repeal and replace Obamacare? How much of a burden has Obamacare placed on your businesses and your families? But I'd really welcome if you'd share for a couple minutes your own experience. We'll take 15 or 20 minutes here. And again, thank you so much for being here. But who wants to speak up?
I'll start out by
Please.
By the administration side. Or I'll turn around this way. So you see.
And share with us your name and who you're
Sure.
with.
My name is Jack Schron, and I'm with Juergens Incorporated. We're a manufacturing company here in Cleveland, Ohio. Ship all over the world, and the burdens that have come in, all the administrative requirements that have been dropped on top of small manufacturers and medium-sized manufacturers. Right now, it takes over 40 hours just to do the administrative paperwork, to do the form filings and the 1095Cs out there. And not only that, then we have to send it out to outside accountants that have to then formalize that, and we have to spend outside attorney or accounting fees to create the documentation. We're looking at probably...
How many employees do you have, Jeff?
We have about 450 employees worldwide, here in Cleveland, Chicago,
Okay.
and we export throughout the world, and we're a manufacturer making stuff here, and if we could get rid of some of those burdens, I know it has a direct correlation with hiring.
So the administrative requirements have put a tremendous financial burden and operational burden.
And it does nothing. It does absolutely nothing other than add to our cost of doing business, which adds nothing to putting a product in the box, hiring a new person, doing anything that we can to increase jobs.
Thank you. Other thoughts on how important it would be to repeal and replace Obamacare? Share your name and who you're with.
Tom Secor, President of Durable Corporation, small manufacturer.
Pull that a little closer to you, Tom.
Small manufacturer in Norwalk, Ohio. In 2014, I went to we have 37 employees. I get to work with 36 great people every day. And I had to make the decision that we were no longer going to offer health insurance. So we had meetings. I brought in our insurance person and let them meet one-on-one. And then somebody in the administration, and I don't know who that was, said, okay, because there was no small business market, we will allow you to continue to offer a non-compliant plan. And so every year we wait and hope that they will allow us to continue to offer a non-compliant plan. And every year they have. You know, these 36 people get up and go to work every day they deserve better than that. They deserve some certainty. They deserve to know there's a market in place. And I have no problem with helping the less fortunate, and neither does our people. But these people need some consideration as well. About a third, via a small business study, about a third of small businesses are not hiring due to Obamacare. About half of small businesses have delayed pay raises due to Obamacare. Now we wonder what's happened to our middle class. They've been left behind because this legislation was about expanding coverage and not anything to do with retaining costs. And the reality is we need something to bring the cost of coverage down.
Right. And have you seen your premiums rise?
We saw, even with the non-compliant
you've gotten those
plan,
one-year waivers, but
with the non-compliant plan in 2015, our average cost per employee went up 24.1%.
Your health insurance did?
Yes.
2015 it went up 24%.
Yes. It then went up 7 and 7 in the last 2 years, primarily because our average tenure was 22 years, and we have employees that are now retiring.
But
so,
let me ask you. I mean, you make a great point, and I don't know. You said you believe that a third of businesses are putting off hiring. A third of small businesses.
Yes,
are putting off
there's
hiring.
a study. A small business study was done.
By whom?
The National Small Business Association.
Okay. And a half of those small businesses in that study have delayed pay raises.
Yes.
Because of the cost of health insurance in the wake of Obamacare. I hear that. I literally hear this everywhere I go. Is the administrative burden, rising premiums, and frankly the quality of the coverage going down and down. I was with a group of families in Washington this week. Came in from around the country, a few from Ohio. He talked to me about the fact that they were paying $4,000 a year for a policy that had a $12,000 deductible, so it was essentially meaningless. And several people at the table, faced with the same choice, simply decided, as 6.5 million Americans have, to simply pay the fine because they concluded that whatever insurance they'd be paying for would effectively not give them coverage at all. Jeanette, your thoughts?
Well, Mr. Vice President, my husband and I, we own a wonderful restaurant in Rocky River. And
how many employees are your restaurant?
Well, originally we had 58. A lot of them were full-time because we had moved from one building to another. And because of Obamacare, we felt so bad because a lot of these people were with us like for 40, almost 25 years. They were with us a long time.
Right.
And we just couldn't afford to keep them. So our biggest thing, we had to lay off a lot of wonderful people because they wanted full-time and we couldn't afford it. So we had to go into the part-time. So today, the 58 have turned into 72 employees because of part-timers.
Is everybody part-time?
A lot of them are, but I had to stay under 50, so couldn't. I mean, that was basically what we did. Right. 29 and 49. Everybody told us to do that.
So you went from 58 full-time employees.
They weren't all. A lot of them were. I had almost 50 full-time.
Almost 50 full-time.
Yes.
But then to avoid all the burdens of Obamacare, you said I have to take my full-time payroll.
Full-timers and do that. Yeah. Otherwise, we wouldn't stay in business, Mr. Vice President. We just can't. Right. Our profit margin is so low. We just can't.
Right.
So.
But do you want to provide health insurance to your employees at the restaurant?
Mr. Vice President, we have tried in the past, and I offered it to the employees where they would pay 50%, we would pay 50%. They didn't want it. They said, please give us the money. They'd rather take the money than have.
Okay.
So that was the honest truth. I mean, that's where we're at.
Sure.
So I would love to. They're wonderful because employees aren't employees. They become like your family.
You'd love to offer coverage.
I would love to offer coverage.
And then people can decide whether they want to have it.
If they want it or not.
Right. Well, one of the provisions that the Republican legislation is advancing is called association health plans, which in the case of the Restaurant Association, see, a major corporation that does business nationwide can have a nationwide insurance pool for their employees. but a local entrepreneur owning a restaurant or a local manufacturer is,
We can't.
We can't
do it.
we can't.
We can't do it.
But association health plans would permit you, because the president's great conviction about healthcare is that if you give people the ability to buy health insurance across state lines or in associations or however they'd like to buy them, and if you allow states to reform Medicaid so that it meets the unique needs of people of Cleveland and the people of Ohio, people of Indiana and my state, that goes a long way toward the kind of healthcare reform and results that the American people long for. But it would give you and your company
We would love
choices
it.
and your employees choices that they just don't have today.
They don't have to.
But it's literally cost full-time jobs.
Yes.
Claudia.
I'm Claudia Kovach, City Machine Technologies in Youngstown. Healthcare is our biggest single expense. I spend $1,700 every day before I even turn on the lights on healthcare. For the last 8 years, we're not getting any more for our money. Prices are increasing and the healthcare benefits are decreasing. I have higher copays, I have higher prescription drug costs, I have higher deductibles, higher premiums for our employees, and our employees are struggling to pay those.
How many employees do you have?
65 employees, and with insurance, CMT pays 80% of the premium, and our employees pay 20%.
Okay.
And our deductibles are great. We have we've always had a PPO, and then the last 3 years we started with an HSA, the health savings account. And I really support the health savings accounts because I feel that you're a better healthcare consumer. But I have an HSA, and we have a $2,600 deductible, and out of pocket's $3,500. And we've had people with cancer in heavy medical issues, and if you're on the HSA, all you pay is $3,500 for your cancer treatment.
Right. When I was governor of the state of Indiana, we introduced health savings accounts into Medicaid. We already had health savings accounts for almost all of our 30,000 state employees. And all the great progress that you see in wellness and in lowering the cost of healthcare around the country is
It makes you think.
consumer-directed healthcare. When you put people in charge of their own healthcare choices,
You make better choices and cheaper choices. You're
you
more
make
cost
better
effective.
choices and more cost-effective. Yeah. Well said. I appreciate it very much. But prices going up, benefits going down. That is the unbroken record of Obamacare. Premiums going up, benefits going down, which is the exact opposite of what was promised. Karen, please.
Well, I would like to ask if you are going to still have that Cadillac tax, because that really doesn't make sense to me that the government should be penalizing somebody for offering the healthcare benefit that they want to. So we would have to pay the Cadillac tax.
Tell me about your company.
Okay, so we have about 1,400 full-time employees.
How many?
1,400.
Okay.
And we're
not a small group.
manufacturing gas compressors. So our healthcare insurance is very expensive, and we also offer wellness care and so on. And we charge our employees very little because we consider it part of their employment package. But because the costs have gone up so significantly over the last 8-10 years, that's less in their pocket and more that just has to go toward this ever-escalating cost. And I was talking to my VP of HR today, and he was telling me that one of the significant things about the way the system works is that all of the providers do this high-pressure thing to people where they say, well, you can pay now. How much are you going to pay? Are you going to pay me now? And so, in effect, they're getting your money, then they are going to give you a credit later on, but that's not right. That, the entire system is so opaque because nobody knows what anything costs. They think it costs $20 to go to the doctor because that's their copay, but in reality it costs $100. And I would like to see there be two things. One,
Okay.
insurance, which is like car insurance, you have healthcare insurance, and I like the healthcare savings account. It's a great idea.
Right.
And the association thing, that's the other one.
Association health.
Excellent idea. And then wellness, which is the healthcare benefits like dentist, vision, doctor checkups, all of those things. That
Right.
should be a separate item from insurance, because insurance should be for catastrophic or out of the ordinary, and healthcare benefits should be a different thing. But we're not separating those out. We keep putting them together.
It used to be called hospitalization back in the day, so you could go to
you
the
had
hospital
Blue
for your
Cross and
hospital
Blue
stay.
Shield if you had to go to the hospital. But now it's all one big mess.
So, how important to repeal Obamacare and the
Absolutely
taxes and
essential.
mandates?
It's absolutely essential.
Very
It's such a Byzantine system. No one knows what it costs. No one knows how to work it. It's completely opaque, and it's extremely expensive. I don't think you could find anybody that would say that it was affordable or that it made costs go down.
And they did call it the Affordable Care Act.
Yeah, that's right. I think that was the name.
I think that's one. It would be funny if it didn't place such a hardship on the American people.
Today we had a cookout, and all the management team makes hamburgers and hot dogs for all of our workforce. And I asked them the one question that was the most concerning for them today,
Yeah.
and it's their health care under what's going to happen before. It's an anxiety that's rippling through every single employee's eyes. I could see we had probably 150 at lunch today, and every person's eyes were scared for their children, their grandchildren, for everybody in regards, because it's so uncertain. We need to get this thing fixed.
Well,
fix it right.
And don't you think, Jack and Karen? I think the American people know that Obamacare has failed.
Yes.
They do. And that's the uncertainty that you can see in their eyes. What's going to happen to my children and grandchildren?
That it's collapsing, and that the political class in Washington, D.C. and many in the national media continue to want to gloss over what virtually every day there's another insurance company that pulls out of these health exchanges. Ohio's had its news in recent days, leaving many people in the state without effectively any choice in health insurance. That's why we're working so hard to get this done.
You gotta get it. But all the press stuff about all these people are gonna die, all these poor people don't have coverage. But you talk to any hospital administrator, I think by law they are required to take care of someone who comes in the door, regardless of whether
No
they have
questions
insurance
asked.
No questions asked.
or not. And every hospital has to raise money and has to account for that. They have that's a big part of their budget.
It's called charity care.
Yeah, exactly.
And
And so,
it's a great
it's not true to say that all of these people will now die because they can't get health care. They will get health care.
But we truly do believe that you can make health insurance affordable
Absolutely.
by giving the American people more choices in health insurance, inviting
Cross state lines,
greater
all that.
competition.
Yeah.
Your point about transparency is a
Yeah.
great one.
So you can shop.
Allowing people with health savings accounts and other innovative methods to be able to become consumers of healthcare, have information to make better choices in their healthcare. And with regard to Medicaid, I will tell you, before I had this job, I was governor of your neighbor to the west. And in the state of Indiana, we also expanded Medicaid. But we did it with what was the most significant waiver in the history of Medicaid. We actually had people be able to have health savings accounts in Medicaid, and people took advantage of it. We're already seeing in Indiana people moving from using their emergency room to using primary care. They're going to the doctor on an annual basis, engaging in wellness. It's actually very exciting when you empower people with the ability to make their own healthcare choices. And when people lead healthier lives, they lead more productive lives. It's a wonderful thing. But this one-size-fits-all Washington press-down solution
Doesn't work for the small businesses.
It is literally collapsing in terms of the individual marketplace. And with regard to Medicaid, my heart broke this week. I had the mother of a special needs child. Was kind of a miracle boy. He looked to be about 21 years old. she's from Illinois, and she said Illinois expanded Medicaid, and the net result was that Illinois Medicaid reduced the coverage of her special needs child. Because once you expand your Medicaid program in the way that it's been expanded in many states, there's still scarce resources. And it was just heartbreaking because Medicaid was literally established to provide what every American would want to see provided for the aged, the blind, the disabled, vulnerable, dependent children, right? And yet now it's expanded.
I just read a statistic. It was in the papers. It said 49% of all live births or all births are covered by Medicaid right now.
There are jurisdictions around the country, states around the country where that's actually true, and that's fine.
That's an incredible statistic.
Yeah, the American people, I truly do. The president and I truly do believe that it's enormously important to be there for people at the point of the need.
Right.
But we believe by giving states like Ohio the ability to reform Medicaid so it can better focus, it can provide better services and then better focus on the most needy in the communities. It's possible. I talked to a woman from here in Ohio this week. I may mention her in my speech, where literally had tears in her eyes at a forum just like this, in which she said she paid the $4,000 a year for an Obamacare card. It's in her pocket. No doctor, no hospital, no clinic in her county here in Ohio takes the insurance that she was required to buy.
20 counties just pulled out in Ohio.
Yeah.
Just
I went on the website. I'm 36. I'm healthy. The premiums for a catastrophic plan, $10,000 deductibles, were more than my mortgage.
Right. I heard that from another person.
Mm-hmm.
More than your
I'm
mortgage.
lucky to have employer-sponsored health care, but I just was curious.
You just
Don't
went, you
change.
looked, I'm 36, I'm healthy.
Yep.
The premium under the policy, that if you didn't have it through your employer, you would be required to purchase.
Yes, it was more than my mortgage
It's more than
payment.
your mortgage. Okay. Obamacare.
I'm Michael Canty. I have a manufacturing company with two facilities, about 130 employees. I echo a lot of what you've just heard. The higher administration costs, both outsourced, because we don't have the expertise, and insourced. Both the outsourced costs and the insourced costs.
How much is that costing you in the outsource without compromising your?
We spend probably $12,000 to $20,000 a year just to outsource. That doesn't include the soft cost, the hourly cost for the various people in-house who have to track that, fill out the forms,
right.
The extra fees we pay on a per
So
head basis.
what would that be? Your internal HR?
We probably spend another $12,000 anyway for a small company. And the key to that, along with some of the other costs we spend, is that it takes capacity away from the manufacturer, away from the company. That's money they don't spend hiring people, buying equipment, building value, which benefits everyone. Our overall costs for healthcare insurance, and we provide that, plus dental, plus eyes, have almost doubled. Tom and I were comparing earlier, his healthcare cost in 2015 went up 24%. Our quote for 2014 was 46. We negotiated it down to 24. Then it went to 8, and this year it was 16. We negotiated it down with only the promise that we would renegotiate next year, or they would pay 9.5% guaranteed next year for the same plan, irrespective of what took place. And those costs are not just by the association or by the companies. Our employees, like many, cover 30%, and we just keep that percentage. So they not only have that cost going up, but the deductibles. We used to have 500 and 1,000 deductibles 6 years ago. We now have 3,000 and 6,000 deductible. So, as you've already heard, some people can't use it, even if they had it.
Right.
And they get a double hit with what's taking place, and the younger people won't do it. Only about a third of our company, which are mostly young, won't take insurance at all because they don't want to pay for it. They don't think they need some of the benefits that are mandated. They just want a catastrophic plan, and so they go without.
One of the more, really helpful. Thank you.
We really need to pass this through the Senate. It needs to get done. And I know you're working, you and the president are working hard on that.
Push it back to the states, block grants.
Yes, that's in the bill.
Because I think that's a great idea. The more local it is, the more state it is.
Look, every state has unique challenges.
Exactly.
In Indiana and Ohio, the scourge of opiate abuse is very real and affects communities large and small. There are states in this country where there are different challenges, different health challenges. And you're absolutely right. Of course, I bring the bias of having been a governor, but it is a centerpiece of this reform that states gain all new flexibility. I mean, giving your governor here in Ohio the ability and your legislature to redesign Medicaid in ways that will best meet the needs of people of Ohio. That's part of the president's vision for healthcare reform. But creating a marketplace where we lower the cost of health insurance, which was one of the broken promises of Obamacare, is that it would lower premiums by several $1,000s, and now premiums have gone up by more than $3,000 a year last time I checked. How about, why don't you give us one word and then we'll run off to this next thing.
So I'm Vince Costello with Diversified Mold and Castings. We're a small manufacturer here in Orangeville Heights. We have 48 employees currently. And
Sorry about that.
when ACA was passed, we did see costs go up significantly. Administrative costs, as Jack mentioned, not only the time spent, but a minimum 5% of costs just in administrative fees. We still offer
Did your premiums go up?
Absolutely. 23% annually.
23% annually since Obamacare was passed.
Yes, we've negotiated those down at times, as Michael mentioned. We've also gone to an HRA. We've had to kick in and pay 60% of our employees' out-of-pocket expenses. It's the only way it can be affordable for them. They do co-pay their premiums. Definitely, obviously, we're all here for a reason. Reform needs to happen. We can't wait for it to happen. The unknown is huge. People don't know what's coming. They didn't know what was coming when Obamacare happened, and those people still don't truly understand it.
Mr. Vice President, if I could just ask one question, as it relates to the health care plan. Because one of the things that always concerns me, and I think it's something that all these manufacturers at the table think about, when we produce a product, we look at labor, we look at the material, we add our profit margin, and that's what we charge the customer. With healthcare delivery, they pick a number, and then depending on which insurance you have, there's a discount off that number. The plain simple fact is, I believe that unless we start driving down the cost of the healthcare, it doesn't matter what insurance is going to pay. I always make the analogy that if you bump out your headlight and it costs $5,000 to fix it, guess what your car insurance is going to cost? So that's the biggest question I have as it relates to driving down at the healthcare cost. I mean, Mike, he just had the baby. He told me the bills were between $25,000 and $30,000. I mean, not that my granddaughter's not worth it. I want to make that clear. But it's, it seems kind of excessive. When Katie was born, it was $5. So he alone would take up 2 months worth of our premium payments.
Yeah, it is. I was in the Congress at the time Obamacare passed. I fought against it. And by the way, I didn't introduce him, but Congressman Jim Renacci here, who's a terrific representative for Ohio and Washington, D.C. He's going to be joining me in a minute. But all the debate was about how do we lower costs. And
cost of the health care.
With the Democrat majorities, it changed to how do we have universal coverage. And so frankly, when you see the individual mandate, when you see fines against Americans that we have 6.5 million Americans who pay a fine instead of paying for insurance. That should tell you something about what the marketplace in insurance offers people in the individual markets. So people are saying, I'd rather pay a fine and get nothing than pay for the insurance that likes which you research for yourself. But it was, what President Trump is committed to is shifting the debate back to lowering the cost of health insurance, giving states greater freedom and flexibility to reform Medicaid to meet the needs of the most vulnerable. But I'll tell all of you, thank you for sharing your stories. I want to thank members of the media for being here, and this is what I hear all over the country. It's what the American people are experiencing in Obamacare, and it's why we're working so hard to get the job done. And I just promise you, help's on the way. Okay.
We're thankful.
Thank you.
We're going to get this thing done. We're going to get a fresh start.
Because our sales aren't increasing at the rate healthcare is increasing, and we need help.
Yeah.
Your concept of association ideas, we belong to the same association. All four of us manufacturers would be a national member of an association plan.
And why shouldn't your local manufacturer like Tendon, like yourself, Jack, be able to buy insurance the way a major corporation, a major national corporation can buy insurance for its employees? These are the changes that can come. Free market competition will work to lower costs, improve benefits, as it always has throughout our history. And with your help and with our Senate's help, we're going to get it done.
Thank you.
Thanks, everybody.
Thank you. Appreciate it.
Did we want to take a quick picture?
Love to.